Hi, my name is Joey. I'm a student nurse, and today I'm going to show you how to administer a medication via a mini bag today. So we have our patient Frida Fritz. We've already confirmed that the doctor's order matches the MAR, so we can put the doctor's order away, and we're going to do our first check. So we have Frida Fritz here. She was admitted to the hospital with cellulitis, so we're going to be giving her Penicillin G. So she has no known allergies. So we're going to do our first check, Penicillin G. Penicillin G Sodium, 3 million units. This is a 5 million unit vial. It's supposed to be given IV route. We're going to give this IV, and it's every 4 hours, and it has not been given yet, so the time is now. So we're also going to check the parenteral drug monograph for Penicillin G. So it is an antibiotic. It can be administered by a student nurse. The maximum daily dose is 3 million units, and the max single dose is 5 million units, so we are well within the range for that. And so for reconstitution, we have a 5 million unit vial here, which we will dilute with 3.1 milliliters of normal saline to get a final volume of 5 milliliters and a final concentration of 1 million units per ml. So I've done the calculation for that, and that means that we need 3 milliliters of this medication. So some other things, we're going to dilute this in 50 milliliters of normal saline, which we have right here. It says 50 to 100. The patient is not dehydrated, so that's why I'm giving them 50 of normal saline, because there's no nutritional indication for D5W at this time. And I'm going to administer this over 15 minutes. And so I'm also going to go over the side effects, so it's nausea, vomiting, diarrhea, headache. If they experience any of these, we'll monitor them. Okay, so now that that's done, I'm going to do hand hygiene, and I'm going to open my vials. So this vial is not expired and it's intact, so we're going to open this up. And also our normal saline, we're going to make sure that this is not expired and it's intact, so that's good to go. And we need our 5 ml syringe, so I'm going to butterfly technique open that, and I'm going to attach my blunt fill needle to that. So before I do anything else, I'm going to swab my medication. So in clinical, I would swab these for 30 seconds and dry for 15, and I would use a new alcohol swab, but for demo purposes, I'm just going to do this quickly. So now that those are dry, we've done the math, and we need 3.1 milliliters here of normal saline. So I'm going to grab my medication and get 3.1. And I'm going to inject air, invert it, get our required amount. Tap out the bubbles, being careful not to touch the plunger. Okay. So we're going to scoop this and just make sure we have the correct amount. So we have 3.1, perfect. And so now we're going to inject this into our medication vial. We already swabbed this, so I don't need to do it again. If I was worried about that, I would just re-swab it. So I'm going to inject the medication, the diluent, and then take out the air to equalize the pressure. So 3.1, I'm going to remove it and cap my needle again. And I'm just going to mix this around in my hands to ensure that the medication is fully diluted. So after I do this, I'm going to look at it and I see that there's no particles anymore, so I know it's diluted. And now we're going to take out our required amount. So with our calculation that we did before, for 3 million units, the concentration is 1 million units per ml in here. So that means we need 3 milliliters. So I'm going to grab 3. But first I'm going to re-swab, I might have touched it while I was mixing it. And let that dry and get my 3 milliliters. Okay. I'm going to inject my air and grab my required dose. Perfect. So just tap out the bubbles, ensure we have the correct amount of medication. Just going to calibrate this so that we have enough. Okay. So we're going to cap this. We're just going to pull back and make sure we have the correct volume, which we do. Okay, so I'm going to show the amount. So that's 3 milliliters there. Okay, so I'm going to do my second check now. So we have Penicillin G Sodium, 3 million units. This is a 5 million unit vial, and we just pulled it up, so we have 3 million units in here. It's IV, this is good for IV, and this is going to be injected into a mini bag, so it's good for IV. And the time is now, it's due every 4 hours, and it has not been given yet, and we have the right patient here, which is Frida Fritz. Okay, so now that we're done with this, I'm going to put these both in the disposable, the waste container. And I'm going to grab my diluent. So I chose 50 milliliters of normal saline, just because our patient's not dehydrated, so we don't need to give them extra fluid, so that's why I chose 50, and normal saline because they have no nutritional requirement for D5W at this time. And I'm just going to make sure it's intact and it's not expired. So I'm going to swab this for 30 seconds and let it dry for 15. And I would have done hand hygiene before that as well. Okay, so now I'm going to grab my needle and insert it into the bag, inject my medication, and put this in the sharps container right away. And now I'm just going to mix this and label it. Okay, so that's my label. And we've done the math for our flow rate, so we have a total of 53 milliliters, and we're going to give it for 15 minutes, so that means we have a total of 212 milliliters per hour. Okay, so I'm going to grab my alcohol swab, my secondary set, and my MAR with my medication, and I'm going to go into the patient's room, and my label for my line. So I'm going to knock, do hand hygiene. Hi Frida, my name is Joey. I'm a student nurse. I'm going to be administering a medication for you today. Is it okay if I just take a look at your wristband? So while I enter the room, I'm going to do a safety check, make sure that there's no hazards anywhere, that the call bell is there, the side rails are up. I'll test the oxygen as well to make sure it's on. And I'm going to look at her bracelet. So can I get you to say your first name and last name, please? Perfect. And your date of birth? Great. And we have the right patient here, and they have no known allergies. Do you have any other allergies? No? Perfect. Okay, so while I'm down here, I'm going to check the pain save the IV site. I'm going to make sure that there's no irritation or inflammation. I'm going to ask the patient, are you experiencing any pain or discomfort at the site? No? Perfect. And I'm also going to be checking the main line for any kinks and any air bubbles. Make sure all the clamps are open. Make sure that there's the right medication in here. So this is normal saline. That's perfect. And there's a line on here that got changed today, and it's infusing at the right rate. So that's all good to go. So Frida, I'm going to be giving you penicillin today. It's to treat your cellulitis. So some of the symptoms you may experience today with this medication are nausea, vomiting, dizziness, diarrhea. If you have any of those and you want to let us know, please call me. I'll have the call bell in reach. Is it okay if I give you this medication? Perfect. Okay, so I'm going to do my third check quickly. So we have Penicillin G, 3 million units, and we calculate that to be the correct amount. And it's IV, this is a mini bag, and every 4 hours, and the time is now. Okay, so I'm going to hang my bag. And put my primary line on a hanger. And next I'm going to prime my line. So I have my secondary line with my name tag on it. So first I'm going to swab the port here for 30 seconds, and I'll let it dry for 15. The one right above the channel so that it infuses at the correct rate that I'll put on here. And this would have a cap on it to maintain sterility. And so would the bottom. So I'm going to clamp this and make sure it's closed. This would have a cap on it. I would remove the cap while maintaining sterility. I would put it on and make it tight. And make sure the clamp is closed. So now that this is on, I'm going to prime it slowly. So I'm going to lower it below the level of the IV and watch the bubbles slowly come out. And I'm going to fill the chamber about halfway. Okay. So now that that's filled, I'm going to remove the spike, the coating on here. It's sterile. I'm going to remove that. Make sure not to touch anything with this. I'm going to spike my bag. And I'm going to label my bag. So I have my label here that says the date and the time and my initials for when I last changed the secondary line. So I'm going to wrap that around here. And now I'm going to input my information. So the rate that we chose is 112 milliliters per hour. And then our final volume is 53. And I want to call back. So we're going to confirm our secondary here. And we're going to start our IV, and that's 15 minutes. So I'm going to unclamp this and make sure I see 3 drips in the chamber. 1, 2, 3. And I'm going to tell the patient, okay, let me know if you have any of the symptoms we talked about. I'm going to do double check that this is still patent, do an exit safety check and make sure everything's in order. I'm going to bring everything out and quickly sign my MAR with my initials and the time. How much time do I have?
You're at 12 minutes.